Approximately one-third of critically ill adults receiving mechanical ventilation die in the hospital. The optimal oxygen saturation target to improve outcomes in these patients is unknown. A new study examined the effects of lower, intermediate, and higher oxygenation targets on clinical outcomes in adults receiving invasive mechanical ventilation. In this pragmatic, unblinded, cluster-randomized cluster crossover trial, the Medical Intensive Care Unit and Emergency Department of a U.S. academic medical center assigned 2,541 adults who were receiving mechanical ventilation to one of three oxygen saturation targets: lower, intermediate, and higher. The primary outcome was the number of days alive and free of mechanical ventilation through day 28. The median number of ventilator-free days did not differ significantly across the groups, at 20 with the lower oxygen saturation target and 21 with the intermediate and higher targets. A secondary outcome, the incidence of in-hospital death, was also similar across the groups. In terms of safety, the incidences of cardiac arrest, arrhythmia, myocardial infarction, ischemic stroke, and pneumothorax or pneumomediastinum were similar across the groups. The authors conclude that among critically ill adults receiving mechanical ventilation, the use of a lower, intermediate, or higher oxygen saturation target did not affect the number of days alive and free of mechanical ventilation through day 28. Full trial results are available at nejm.org.